Hi, this is Vic Gatto from the Health Storm. Thanks for tuning in. Today I have a great guest, Bruce Crosby from Health Velocity Partners. He's the managing partner there. Great guy. He has a deep experience in operations and investment. He's bounced back and forth on Wall Street and then done operations. And now he's an investor at Health Velocity. We talked through all the issues of the health storm coming, where to invest today, where it might be a little bit too early, his process to make investments. Great show. Please tune in. Bruce Crosby from Health Velocity. Thanks. Bruce, thanks for doing this. I'm excited to get into it.
Absolutely.
So talk to the audience about your background. You've been an operator, you've been in investment banking, you've been in a VC, you've been an operator again, lots of different roles. Talk about your perspective and what led you to today.
Yeah. So I was lucky. When I graduated from college, I ended up working at what was then a startup company called the Advisory Board Company based in Washington, D.C.
Yeah, pretty good, pretty successful startup.
Very successful. Split into 3 companies over time. But when I was there were maybe 25 people or so working. Yeah. And we were in townhouses. I wanted to go into they had 2 divisions, banking and healthcare. I wanted to go into I wanted to go into banking. And when I got there, they said, no, you're going to healthcare. Huh. And I had no idea.
So actually, you kind of went begrudgingly into healthcare.
Absolutely. Yeah. I was like, I want to be in banking. That was cool. And here, almost 30 years later, really happy that I've spent
I didn't know
my
the
career.
advisory board even did banking.
They did.
Yeah.
Initially, that was their first product line, if you will. But from there, as you said, went to Wall Street, spent time at J.P. Morgan, both investment banking and then investing in healthcare companies. But really longed to get back for a period into the operations side. And so in aggregate, I've spent about 20 of my 25 years in operations. Mm-hmm. And it's been, I think, really helpful in preparing me for moving back now into the investing side, where we've been with Health Velocity for the last 4 years.
Yeah. So talk about that, the differences between being an operator and being an investor, sort of partnering with operators.
Yeah. You know, what I really enjoyed about the operation side is you are absolutely on the front lines of providing care to individuals. And that's obviously why we're all involved in healthcare. And had the opportunity to work at a couple just wonderful companies that were providing a different type of care, and we can talk about that later, but innovative models. And, you know, I was always in support roles, helping to grow the company, but really supporting the frontline nurses, nurse aides that are helping individuals really battle with different healthcare issues.
Yeah. So it's more a direct experience as an operator, where you're day-to-day on a project. Even if you're in support, you're building that mission.
That's exactly right.
Versus, at least for me, the investing side is I get to work with more companies, but I'm not as directly with any one.
That's exactly right.
Yeah.
That's exactly right.
Which do you prefer? Which do you like better?
I really enjoy the investing side now, having been on the operations side. I feel like I can be a better investor having been in the trenches, helping to build a company. I feel like it just makes me a more aware investor. Yeah,
you understand the perspective better. And you probably you're more identified, can be more helpful.
Exactly.
Yeah.
Exactly.
Okay, good. Well, I think you know that the show's called The Health Storm. I have this thesis that there's a lot of change sort of on the horizon coming to the healthcare space. But the question for our discussion today is, like, when is it going to come? Mm-hmm. So not so much like, is there a storm out there, but what's the path of the storm, or where's it going to hit first?
Right.
And I'm trying to break it into component parts. And so I see kind of 4 different aspects of it. And let's just talk through the different pieces.
Sure.
So the first is the rise of the consumer. So consumers are trying to take back control or take more control over their own health. Next is technology advances. So there are new tools, more data, more ability to maybe do diagnostic tools early, catch things earlier. There is care moving away from the inpatient facility into the neighborhood or the home, and there's market entry from non-traditional players, big, maybe they're tech or retail players that haven't normally been thought of as healthcare that now are jumping into the space. So talk to me about how you think about the changes in the industry and where do those trends make sense? Where do they need to be reevaluated?
Yeah. So we would agree with you on many of those trends. And I think the way we've thought about it at Health Velocity is that more than at any point in our 25-year career, I think there's alignment around those themes. And I'd modify them a little bit to say that I absolutely believe that the consumerism is affecting healthcare. I would secondly say that with the HITECH Act in 2010 and the dollars that have been poured in to install electronic medical records in both physicians and hospitals, we now have a digital foundation on which we can do more of the analytics and use more of the technology that you were talking about.
Yeah, and whether you think that they have been very effective or not so effective, the HITECH Act has sort of incented the digitalization of all the health records. So at least now they are in digital form and able to be used.
That's exactly right.
Yeah.
And it's not perfect. They don't talk to each other. There's and that's the opportunity in healthcare.
That's the
there's
next
so
step.
much more to do,
Right.
but at least the foundation has been laid. And then we would say that everything has to drive towards being more cost effective, have to drive down the cost of healthcare. And that leads to things like what you were talking about. How do we move things to lower cost settings and kind of drive down the cost of healthcare? So, those themes, I think, and I guess just sorry to mention the fourth would be the shift in payment models from fee-for-service to more value-based care. And I think it's taken longer than we all thought it would. But I would say that's another kind of thrust right now in the healthcare industry.
Yeah, and so where it gets pretty interesting is combining these things. So can you find opportunities to invest at Health Velocity in something that is in a lower cost setting and it's more convenient for the customers and it has maybe a different reimbursement model?
Yeah, absolutely. And just by way of example, we've got an investment in a company called IVX Health here in Nashville. It's a great example, right?
Right. Yeah.
So what they do is they provide infusions for non-oncology drugs in an outpatient, very consumer-friendly setting in a retail, Class A retail setting.
Well, you used to have to go down to the hospital and spend half your day parking and finding the place, and now you can do it right in your neighborhood.
That's exactly right.
Yeah.
And for a half or even a third of the cost to the insurance company, it's a win all the way around. And I guess the last thing, kind of back to the consumer, is it's not only convenient for them, but they're getting net promoter scores in the 90s. And so just absolutely loved, net promoter score of 90 specifically, absolutely loved by the consumer.
Yeah. Right. So those kind of things are growing over the next 3 months, or you think 5 years? I mean, what's the pace of change?
Yeah. I think it depends on what we're talking about.
Okay.
Services like infusions being done in an outpatient setting obviously is happening now and will continue to grow over the next 3 to 5 years. But I think there are other shifts that are just going to take time. I mean, the shift from fee-for-service to value-based care is just going to take time.
Yeah. And I see kind of pockets. I mean, healthcare is so big that it can be a decent-sized market, even if it's a pocket, right? But Medicare Advantage, I think, has done a pretty good job aligning interests and moving us to kind of a market-based, value-based reimbursement model, where MA plans are very incented to try to figure out ways to deliver more holistic care. I think there's some pockets where employers are starting to try to be more intentional, more aligned with things. They're more slow, but
that's right. I mean, here's an example. my partner Marty Felsenthal and I, in 2009, were looking at telemedicine. It was the early days of telemedicine.
Yeah.
He invested and was the lead investor in a telemedicine company, Teladoc, and restarted the company. We're 10, 11 years later, but at the time it was a $10 million valuation company, and now it's a $10 billion publicly traded company. It's
and growing, and still growing.
Still growing 55% a year.
Right.
So it's taken 10 years, but I think we're now at a point where telemedicine has become an acceptable means of accessing the healthcare system, although still relatively low utilization. But I think we're reaching a point of awareness where people are starting to use it more. But that's taken 10 years.
Yeah, and I think it used to be, 10 years ago, it was very niche use cases. Right? So I don't have transportation, or I have one sick child but two other children, and I can't cart them all around.
Yeah.
And now I think we're seeing that it's better quality, better service, easier.
Yep.
You don't lose
Lower
you don't lose
cost, more
anything, and lower
convenient.
costs, right?
Yep. That's exactly right.
And so more and more situations are kind of very useful in telemedicine.
That's right.
And then as people have a good experience, they want more and more. And that's from
exactly
the provider side and the patient side, really.
Exactly. And let's touch on the provider side, because I think that's something worth spending a minute on. Telemedicine initially was really resisted by both physicians and hospitals.
Yeah, it was at first, Teladoc particularly, but all of them were sort of a payer-thrusted thing.
That's right.
Yeah.
Payer and employer.
Yeah, yeah.
And now you've got a situation where hospitals are looking at them as a means of acquiring patients, of retaining patients. You know, this concept of the front door of healthcare.
Yeah.
Health systems are embracing telemedicine as another way of caring for their patients.
Yeah, and it's
That's
a
big change.
referral channel as opposed to something they're fighting against.
That's exactly right.
Yeah.
That's exactly right. And that change has happened over the last 3 years. So you've had along the journey different participants in the healthcare system kind of adopt telemedicine in different phases.
Yeah.
And I think that's going to be true of healthcare, as you've outlined, maybe starting at the edges and moving in towards the center.
Yeah, and so talk to me about your view of where health systems go. Like, I kind of think that there aren't going to be hospitals and docs and payers anymore, but they'll just be like fully integrated health systems. I mean, I think Optum Care is probably the biggest employer of doctors, or one of the biggest employers, even though they're traditionally thought of as a payer.
Yeah.
And health systems are figuring out how to underwrite and be insurance.
Yeah.
Do you see that trend continuing?
So the underwriting part, becoming a payer, I think has been more difficult than many of us thought, and it's taken longer. I think there's been less success on the ACO side than maybe we would have anticipated.
It's interesting because 5 years ago or 10 years ago, people thought that would be the easier side, and it's turned out to be the inverse of that, really.
Yep. There are some integrated health systems that do extremely well, UPMC and Geisinger. I mean, there's some that Intermountain that do it really, really well. But it's the exception, I think, rather than the rule. I think what we're seeing,
and they're really regional, mostly they're regional players.
That's right.
Yeah,
that's right. And I think what we're seeing instead is you've got health systems that, on the value side, are taking on bundles, packaging things up in bundles, and that's kind of their value-based approach. And the other thrust of their strategy is, how, as you were describing, how do I really become everything to a patient, where it's everything from a doctor to clinics to outpatient ERs to urgent care centers, and that whole continuum of care where people really identify with a brand and they seek care from my brand as a health system. Yeah,
so I think that I agree with that. I would argue that there's a little bit of a misalignment of incentives. A lot of health systems are still generating a lot of revenue or a lot of free cash flow from procedure-based fee-for-service. And so they are not incented to sort of pull in an underwriting capacity and really morph to a fully integrated payer-provider system. Maybe they can turn on a dime. We both have friends here in town that are sort of ignoring fee for value and think they're going to change quickly when needed. I don't know if they'll be able to change that quickly.
Yeah.
So I feel like the insurance companies have woken up and are moving much more quickly to try to build out the full thing.
Yep.
Maybe because they have to.
Yeah.
But they're more aligned on we got to figure this out.
Yeah. I think that's right.
So,
Yeah.
Okay, so I want you to talk about sort of your investment thesis around timing. So, timing is really everything in investing in healthcare. You can be right and 5 years too early, and it feels a lot like being wrong, and you lose your money, right? And so you're a VC, you're investing in this space. How do you think about what are the signals when something is the right time to jump in?
Yep. For us at Health Velocity, we invest in companies that have between 3 and 50 million of revenue that are growing 25+% a year.
Okay. So there are financial signals that help.
Correct. What we're looking for is real commercial contracts, not just pilots. They have they've got a business model, they've got a structured and set way that they're getting paid, and it's replicable. They're starting to sell it the same way across multiple buyers. They've got a pipeline that you can touch and feel.
And a history of actually conversion.
That's correct.
Yeah.
That's correct.
Yeah.
It moves through the pipeline.
Yeah, right.
And Vic, I'd say the last thing is we will make 30 or 40 calls out to our network. And a little bit of background on Health Velocity, about 2/3 of our capital comes from large strategic healthcare organizations, like insurance company, like hospitals.
They're investors in your funds.
Correct.
Yeah.
And so we will reach out to both them, but also just our networks over 25 years and really get a sense for where the market is on adoption. What we'll typically find is real buying signals that this is a need, they're looking for a solution like this. And that's most of the cases. In some instances, we might be a little bit ahead of the curve. They can't quite articulate what they're looking for, but you can kind of take one and match it with another and say, yeah, I think this is the solution.
They're describing a similar set of symptoms, maybe, to take a healthcare example.
That's right.
They don't know what the underlying cure is, but they have the same problem.
That's exactly right. And again, not to beat a dead horse, but if you go back to telemedicine in 2009, what they were describing was, geez, there's a real shortage in physicians, and I don't know how we're going to meet this shortage. And it's really hard to find doctors in rural parts of America. How are we ever going to solve that problem? Or, we're operating ICUs in rural areas without the expertise we need. How can we supplement that expertise? And then you look at telemedicine and you say, that might be a way to solve that problem that's sort of being articulated.
Yeah. And so you will see a possible company to invest in. They have the right financial metrics, but that's just the starting point. Then you go and make these 20, 30, 40 calls to sort of learn about the space.
That's right.
Is it fair to say that sometimes the feedback is too early?
Yeah, absolutely.
And so what happens with the company? You just call back and say, seems like too early for us?
That's exactly right. And I'll give you a very real example. We've been looking in the reference-based pricing area. This is obviously plays in. So the concept of reference-based pricing is you create an insurance product that is based off a multiple of Medicare, Medicare typically being the lowest reimbursement. And it's a way for employers, small employers, mid-sized employers to acquire insurance at a lower rate.
Yeah, so just to make sure everyone understands in the audience that you're not tied into a particular insurance network.
Correct.
The employees can go anywhere to get service, but the employer is going to pay 150% of Medicare.
Correct.
Or some
That's
reference multiple on the reference, which is usually CMS's
That's
rates.
exactly right.
Yeah.
That's exactly right.
Okay, so people have been interested in that for decades. It's an attractive model,
Right.
because it's simple and would save money.
That's right.
But why has it not been fully adopted, and where are you thinking about it now?
Right. So back to your making calls. So it makes a ton of sense on paper. And so we made a lot of calls out to brokers, employers, and just try to get a sense for where, and brokers are typically the ones that are distributing it to small, mid-sized employers.
Tell people about it and sell
exactly.
it. Yeah.
And what we heard again and again was, this is a lot of work for me, because when employees go to use this non-network and they end up having to negotiate prices because they may not have contracts with those providers, there's a lot of friction that employees feel that gets then pushed back onto the brokers to address. And so between the brokers and the HR directors, they just feel like there's a lot of friction to rolling this out. So even though there may be cost savings, the employee kind of pushback and difficulty in accessing the healthcare system makes it not worth it right now.
Right. Well, and then there's a lot of fear around balance billing, or like the hospital may not accept the reference
That's exactly
payment.
right.
And then a lot of times they will come after the patient.
That's right.
Now, whether that is legally enforceable or not is debatable, but it's still kind of scary for me to get a big bill when I thought I had insurance coverage through my employer, and all of a sudden I have this extra bill, and what do I do with that?
That's right. That's
so
right.
I basically complained to my HR guy.
Exactly.
And he can't really help me because it's directly between me and the hospital.
That's right. That's right. So it's an area that makes a lot of sense. I think employers are really struggling with the rising cost of healthcare, but it's not ready for it. The market is not ready for it.
Yeah, so one of the things that I'm looking for is a catalyst. So like there's all this pent up trends, like the demographic, the boomers are aging.
Yeah. And
as we age, we need healthcare. And it's very expensive, and our outcomes are bad. And consumers are, we talked about 4 other trends. The consumers are trying to take control, and the hospital is getting sort of unpacked. There's all these trends, but those trends have been there for a long time. And so one of the things that I'm exploring in these interviews is, what would a catalyst look like, or how would things change in a 12-month period? And one of the things that I'm thinking about that I want to get your ideas on is the upcoming election, because I think there's going to be a lot of talk about healthcare. I mean, every day there is a news cycle about the coronavirus or the election. That's all I hear about is what the election's going to do, or I have to wear a mask. We should be wearing masks right now.
Exactly. I know. We're way too close.
I know. And so if Trump wins, I think he's going to push price transparency. Even he already has executive order for it. Maybe it will make it through the courts before the election. It feels to me more likely that things get delayed and drawn out just because lawyers and courts are delays. But if he gets reelected, there'll be 4 more years to really push that. That may be a catalyst to a change in a lot of things, but reference-based pricing, I think, would benefit from that.
That's right.
Because you'd have lots of references, and you could do some kind of weighted average or much more nuanced reference that could be much more accurate.
That's right. That's exactly right. And I would say one of our advisors is pretty tied in D.C., and what he's seen is more than at any point in our careers, agreement both among Republicans and Democrats that this surprise medical billing should stop, and they need to do something about it. And if you look at the recent Kaiser family poll, like 2/3 of Americans agree that the government should step in to stop this surprise billing in some fashion. And the same with the rise in prescription drugs. I think there's also some alignment that something needs to be done. To your point, those could be, if something were passed in Congress, those could be catalysts where now you've got some benchmarks to work off of.
Yeah, and so I think what I am watching is certainly people could be more effective shoppers, right? If you show everyone the price of things, they can make more informed decisions.
Yep.
But I'm not sure that has a huge impact because I'm sort of going to do what my doctor tells me to do. But I think market entry, I mean, we're both VCs. If you show me all the prices, I can see huge sort of market need and areas where I can pull off service lines and really do well, provide a much more price competitive service, and my cost is going to be much lower.
Yep.
Right now, that's very opaque. It's hard to know because you can't. It's challenging to get the network pricing.
Yep.
And so maybe the shoppers will have an impact, but I think innovation will be able to move in and really make a difference in kind of how things are brought to market.
Yep.
Does that make sense to you?
Yeah, I mean, I think we still, in terms of the price transparency and the executive order, physicians and hospitals, obviously are not in favor of that. And, it's like Walmart publicizing what they purchase, their products, but before they sell them. At some point there's something that is proprietary about that. So there's always, in healthcare, there's always, some resistance to change.
Unpack that a little bit, because I've had a hard time understanding that. And so if you take a hospital system, what they charge for everything feels like the price that they are delivering service to the market. I don't need to know what they pay for the land and their heating bill and the doc salary and what it costs to do the cafeteria. I want to know what it costs when I buy something.
Right.
And that seems like every industry in the world has that.
Right. So as you know, I think the devil in the detail is that each insurance company has a different price that they've negotiated based on their buying power in many respects.
Yeah, there's no question about that.
And so I think there's an unwillingness to expose who's got the best buying power and who's got the best price in a particular market.
Yes.
Fair or not.
Right. So
I just think that's the reality.
That is the argument.
Yeah.
But I don't think that the insurance companies are really the entity that's paying. I think that the employer is often paying. And so the entity that's buying the service should be able to see what the prices are.
Yeah. And we'll see if that's where they end up. We think when you put JP Morgan and Berkshire Hathaway and Amazon together, that is probably where they end up, is negotiating directly and having very clear sight on what they're paying.
Yeah, that's right. And you wouldn't have to have that buying power if it was all shown.
Fair point.
So, okay, well, let's move on. So in the Valley, people will say the best innovations happen in Silicon Valley, or a lot of great innovations happen in Silicon Valley, and they are known for like fast iteration and kind of throwing things together and seeing what works. Kind of move fast and break things was the Facebook thing early on. And my assertion is that kind of cavalier attitude to regulation doesn't work in healthcare. But I want to see what you think about that, because we do need to have change come to the market. But I think we also need to be careful about how it's brought out, and patient safety and privacy need to be respected.
Yeah.
So where's that balance in your mind?
Yeah, I think two things. Just kind of historically, you've seen some of those big technology companies come in and out of healthcare over the last 20 years and try things like the Health Vault,
Right.
Microsoft.
Yeah, they come
20
in
years
and
ago
they waste a lot of money, and then they find it's pretty hard.
It's
and
really
they leave
hard.
again.
And there's a lot of regulation, to your point. And so, I think they have evolved and gotten a lot smarter. You've seen them hire some very senior, talented healthcare executives to lead their health program.
Yeah. That's what got my attention with Google is they hired a bunch of really strong operators this time.
That's right.
That certainly know how the game is played and know the regulatory environment.
Exactly.
But now they have a huge balance sheet and a bunch of data.
Exactly. And I think that's where an outsider technology company becomes more of an insider because, they've taken
David Feinberg certainly knows how to run a hospital.
Exactly.
He's not going to be surprised about how the regulatory environment works.
Or the difficulty of pulling data and putting data together and the things you have to be careful of with HIPAA, et cetera.
Yeah.
So I think we are in a new phase of Silicon Valley, if you will, or technology coming into healthcare. I still think, though, that healthcare moves at a different pace than other industries and technology. And certainly as Health Velocity, as we think about capitalizing companies and funding companies, we are much more conservative in how we think about building companies and funding them because in our experience, it just takes a longer time. So the idea of giving a company $100 million to go build something big, in our opinion, just doesn't work as well in healthcare.
Yeah. I mean, I think Teladoc is a good example. They're growing very quickly and have been for a long time, and it's taken 10 years or 11 years.
That's right.
Yeah.
Yep. So we would.
Okay.
Yeah.
Now, do you think there's going to be kind of a aggregation of lots of pieces and parts and foundational tools that then cause kind of at some point in the future sort of standing on all of those technologies and innovations that came before, you can start moving quickly and almost like a Lego set, sort of take pieces and parts and put them together.
Yeah.
Does that exist in healthcare, do you think?
Not yet. And I think that's where interoperability really comes into play.
Yeah.
And we talked at the beginning about how it was great with the High-Tech Act that we now have EMRs, but they don't talk to each other. And I think the next phase is creating that language where they can talk to each other. And I think if you can truly put together my health records across the different locations that I get care and now have a longitudinal look at all of my health care, I think that's where things can really start to take off.
Yeah, and that is something that I mean, I have no inside knowledge, but that's something that a platform like Google is well positioned to do. Right? They can pull data from lots of sources and then give me an interface to engage kind of at a one level up.
Right.
Almost like the lab systems in hospitals today, they haven't gone away, right? But those lab systems are just plugged into the EMR. I think you might have 5 or 6 different EMRs plugging into a new kind of overlay interface that the docs and the patients are interacting with.
That's interesting. Yeah, I think that makes a lot of sense to me. Or if you look at the cable industry, they came together to create standards so that they could communicate and exchange content and take it to the next level.
Right. Yeah, I don't know that the EMR companies are friendly enough to do that. But if they don't, someone else might come in and sort of just build a layer on top.
Yeah. So. Yeah, the CEO of Epic was on 60 Minutes a couple of weeks ago talking about the benefits of Epic being a self-contained system. Right.
And, she is well-spoken and she has some personal interests in that.
Exactly. So your idea of putting something on top of it makes a lot of sense.
Yeah. Okay. Talk about Health Velocity and your, I'm going to call it a strategic LP base, and how you can really maybe add more than capital to the portfolio companies. How do you? I think that's pretty different than a lot of VCs out there. Yeah. How do you phrase it, and how do you talk to management teams about it?
Yep. It's a really important part of our strategy, and it's something that we really pride ourselves on doing, is leaning in with our portfolio companies and rolling our sleeves up and helping them make connections in the healthcare industry so that they can grow faster. And it
almost starts during the due diligence. But like you begin these calls, and if you start getting really positive signs, one that makes it interesting to invest in, but then you have this built-in network that you can introduce the company to.
That's right. I'll give you two examples. Maybe it'll bring
Yeah.
it to light. So we invested in a company called Well Health, which very simply put provides an ability for providers to communicate with patients via text, predominantly about administrative things. We were looking at one company that did this and started making calls, and through our calls were introduced to another company, a competitor, that was also doing it, and really liked the CEO of this second company at Well Health, and so after passing on the first company,
So at Well Health was not the first company. You sort of met them through the due diligence process. Yeah.
And Well Health said, we're not raising capital. And we said, that's fine. We're really interested in the area. How about if we introduce you to 10 or so of our friends who may be looking for this kind of solution? After 10 demos that started to turn into cash-paying customers.
Right. All of a sudden, and they need working capital now, too.
That's right.
Yeah.
The CEO came back to us and said, hey, I wasn't raising money, but you guys are already helping me grow my business. Why don't we create a round that you can invest in? And, it's an example of how we like to kind of create value from the outset. The other is Contessa here in Nashville, where, we started, I met Travis many years ago, but loved what he was doing. And when I would meet a...
So before you go into this, talk about what Contessa does.
Yeah, sure.
They're actually a great example of care moving outside of the hospital.
That's exactly right. Contessa provides hospital-level care in the home. The patient qualifies to be admitted into the hospital for pneumonia or CHF or COPD, cellulitis, but instead of being admitted to the hospital, they're sent home with all the nursing care that they need, durable medical equipment, infusion, et cetera, and cared for at home, and the physician then rounds on the patient via telemedicine.
Okay, so they present in the ED.
Correct.
And instead of sending them upstairs and admitting them, they sort of admit them to their home.
That's right.
To their home facility.
That's exactly right.
Yeah.
And so
with that background, you were talking to Travis about what he was building.
Doing.
Yeah, Travis is the CEO.
Early on,
yeah.
Travis is the CEO. Thanks for the context. And as I learned kind of the management roles that he was looking for, I would introduce him to executives that I thought were wonderful. He eventually did hire one of them.
Just helping them build the company
before
you're an investor.
Yeah. That's right. And then we were doing diligence. We introduced him to Dignity, which is one of the largest not-for-profit hospital system in the country. Really liked what they were doing, fit with their strategy, and they ultimately signed a national contract with them. So, we love playing that role. And if we're just a check, it's really not interesting for us. And
it's hard to win the deal on anything except price.
That's right.
Like if you are always paying a higher valuation just to get in the deal, almost by definition, the fund economics won't work out that great.
That's right. Yeah. That's right. So it's what we enjoy doing. I think it differentiates us a bit in the market.
Yeah. Now, the other thing Health Velocity has is 2 offices, San Francisco and Nashville.
That's right.
Which is a really interesting way to approach the market.
Yeah.
You sort of have the coastal office, but then the Middle America office too.
That's right. And as you know, Nashville's such a center for healthcare innovation that it's wonderful to be here. And San Francisco, same thing. With
I think it's a
health.
great combination. I mean, having one leg in both sort of gives you a perspective that not many other firms have. They're either all digital all the time in San Francisco, eating ramen, or they're in Nashville, sort of talking about heads in beds and
eating barbecue.
Eating barbecue, right? And you can go, you go both ways, Bruce.
That's right.
Yeah,
exactly.
Okay, excellent. So, do you have any concerns about the innovator's dilemma? Like, I worry about us bringing kind of incremental innovation to health systems and payers. And then kind of waking up and there's a big change from some new entry. And every day there's another entry. But, You can pick. You said Haven earlier. I was talking about Google, Walmart, Apple. I mean, there's a bunch of players all the time that are threatening to come in. As you said, sometimes they come in and then they quickly exit. But eventually, maybe there'll be kind of a big change.
Yep.
How do you think about the innovator's dilemma? Is it a concern at all?
I mean, it's a great question. What we have told our strategic investors is that we very well will invest in companies that will compete with them.
Yeah.
And that's exactly.
So they should be ready for that.
Right. And that's exactly why they're investing in us, so that they do have a front row seat on innovation, what's happening in the market, and aren't surprised by it. And also that, it's innovation that's happening outside of their walls, back to the innovator's dilemma, outside of their walls, where it can grow and accelerate without the constraints of kind of having done it the same way historically. I think that's one of the advantages they see about investing in our fund.
Yeah, interesting. So, so none of the strategic investors are on your investment committee, or they
are not.
Yeah, so they're not. They don't have a vote.
They don't.
They can watch.
That's right.
But they don't get to say, "That's scary. Don't do that."
That's
deal.
correct.
Yeah.
That's correct. And we were very purposeful when we set out. We said some things will be scary, and that's why you're investing.
And we should do those.
Exactly. That's exactly right.
Yeah. So I think at Jumpstart we try to understand the buyers first, because we're earlier. So we're typically, very little revenue. And so I want to know that the buyer community, whether it's a hospital or a doc practice or a payer or a retail center, there's someone who will buy this if I can execute it, deliver it.
Yeah.
And so we're often talking to the industry before we have the innovative idea about what's the problem. And maybe the second year in, I guess, we brought back a solution to a large retail chain that I thought was going to solve their problem, and they absolutely hated it. Like a visceral, emotional, get out of my office, how could you bring that in kind of thing. And so Marcus and I, my partner, we decided that we want to find things that the customers love, but hate is pretty interesting too. Right? So indifference is really the opposite of love. So if the market is really against it, that's kind of interesting. Obviously, we need to find a new customer and go a slightly different direction, but maybe we should invest in that and learn more about it.
Right. That is interesting. Interesting example.
So, okay, good. So, talk to me about, you've been in healthcare. Sorry you didn't get to go into banking, but you've been in healthcare on the operating side, the banking side, the direct investing side for 25 years back and forth. What do you know now that you wish you knew in 1995 or when you started?
I guess getting into healthcare for me was, as I explained, serendipitous. It was not intentional. But having invested now in learning about healthcare, as an investor or really as any employee within healthcare, you really develop, there's some barriers to entry because it's a hard industry to learn and understand.
There's a whole lingo and way that the business works that's confusing.
And payment models and reimbursement models.
Right.
And, so I would encourage, folks that are thinking about healthcare, that it's a fascinating career. There's a lot of different segments of healthcare that are all a little bit different. And once you move into it and spend time in it, you're creating value, for your career because it's hard for others to get in, and it's almost a barrier to entry that helps you as you move through your career.
Yeah, interesting, and it's important. Like obviously we're both biased, but my view is that in the next 20 years, our society has to figure out health and climate. And those are like not that we don't have to figure out other things, but those are the big things that are not at all clear now.
Right.
But that we have to figure out like as a society.
That's correct.
And it's fun to be like in innovation, in health. I don't know anything about climate. I'll let someone else worry about that, exactly. But I do know health.
That's right.
So, yeah.
I mean, our healthcare system right now is not sustainable.
Yeah.
And we have to find solutions to make it sustainable.
The interesting thing is that the U.S. healthcare system is not sustainable, and yet there aren't other models around the world where you say, like, that's perfect, let's just take that. Every system is, better in some ways and worse in other ways.
That's right.
And so I think we have the absolute best quality care. If you are really sick anywhere in the world and you have the means, you come to the U.S.
That's right.
And yet we do not have sort of the breadth of service, and we're very expensive, and we don't have great outcomes across the entire spectrum of things.
Yep, that's right. That's right. And we're willing, and we've made this decision as a society, we're willing to spend and do whatever it takes to try to provide care at any cost to help somebody in their health or save their life. And I think as a society, we have to think of, at some point, we don't have all of the funds, all of the resources to do that all the time.
We can't do that in every case.
That's right.
And then I think there are levels, right? Like, I don't know. I mean, sometimes we have to say to people, okay, you're getting older, and maybe you can't be the number one tennis player at your country club anymore. We're not going to give you 2 new knees so you can be the club champion for the 9th year in a row. Right. You'll be fine and lose a little weight, and you'll be in second place. You may have to go down to the division. We're not going to give you 2 new knees just so you can keep your AA tennis game.
That's right.
And yet today there's a lot of new knees and hips for what I'll call lifestyle reasons.
That's right. And I mean, another example is when I was at Compassus, we started a palliative care program. Compassus is one of the largest hospice providers, end-of-life care providers in the country. And we started a palliative care program. And what palliative care does is basically talk to people about what their goals are as they, it particularly plays in if you're very sick, you're frail, you're elderly, and you probably have about 3 years of life left to live or less.
Yeah. And how do you want to spend the 3 years?
How do you want to spend those 3 years? Because left to inertia, you will die in an ICU on a lot of machines.
Yeah.
That is what our system is set up to do.
And we will eke out from 36 months, we'll get you to 38 months. But you're going to spend 14 of those months in an ICU.
That's right. And
even just forget the cost, just the pure quality of life.
That's exactly right. And when you ask people, how do you want to spend the last days of your life? Almost everybody says, I want to be with friends, I want to be with family.
No one wants to be in an ICU.
Exactly. So it's having those conversations earlier and getting people to really think about how they want, because that's when the cost curve really goes that. Right. And so if you can kind of change that to that, and that actually reflects what people want, right, that is a great way to save costs.
And we have to, doing it 3 years ahead is right. You have to do it when the patient can make his or her own decision.
That's right.
Because once they are in the hospital bed and you and I are brothers talking about how we're going to take care of mom, it doesn't work.
That's right.
No one knows what she wants.
That's right.
And the doctor's saying, well, here are the options.
That's right.
And it's also, not our money.
Right.
And so do whatever you can.
That's right. I don't want to make that decision.
If you actually asked her, mom might have said, I want to be home with my cat and my grandkids, and I've lived a great life, and I want to have the last 3 years be enjoyable.
That's exactly right.
And if you ask doctors, they don't want to be in an ICU.
Right.
So
exactly right.
They have seen it enough that they realize the truth. And so it's really just a communication, education thing.
That's right. Yeah. But it's a great way for our society to save money and have a conversation.
Yeah.
And align interests.
Yeah.
So.
Okay. Any other trends that we haven't talked about that we should touch on?
But, maybe the last one that I would mention is healthcare navigation. It's a complicated healthcare system. Employees, individuals need and are looking for help in navigating. Mm-hmm. We recently invested in a company called Health Joy out of Chicago. that sells to brokers. It sells to small and mid-sized employers. And almost on the opposite end of the spectrum as reference-based pricing and the kind of diligence calls we're making there, brokers and directors, HR directors, were absolutely, leaping off the page at how wonderful this product is, because what it does is provides an app on your phone that consolidates in like an Apple Wallet, but it's a healthcare wallet, all of your benefits information, medical, dental, vision. Telemedicine is in the wallet, so if you need a doctor, you can click through and connect. And if you have questions about your benefits, you have questions about a provider that's in the network, if you have a question about where to fill your prescription or is your medical bill right, they've got a concierge service that you can
it's
ask
all right
those
there.
questions.
You can
all within one.
You can
little
text
app.
or call, and you don't have to remember where your insurance card is and call some number. It's just all in the app.
All in the app, and HR directors love it because it makes their lives easier. And employees love it because they know where to go for their specific healthcare information.
Yeah, and it's mapped to my plan.
That's exactly right.
Yeah.
You know where you are in your spending against your deductible. You know where you are in your spending in terms of your HSA. If you've got an HSA balance, it's all right there. But I think navigation is really important because, HealthJoy is starting with some pretty simple services and technology. But you can see how it can build on that as you start to layer on things like, okay, I have diabetes, and now, all my questions about my diabetes can also be through the same app and can help me go to the right clinicians that I need to get to, et cetera.
Well, and one of the things about the rise of the consumer trend, right, is that if everyday people, are going to be able to take control of their health, they need tools.
Yep.
They need tools like this. They need to understand what things cost. They need to understand, should I get a second opinion or not?
That's right.
All these things that in other industries, there are lots of support tools for.
Yep.
And they now need to provide that for people.
That's right. And they need it communicated in an everyday manner that they understand.
Yeah.
So in this app, it doesn't say, click through for telemedicine. It simply says, need to talk to a doctor.
Yeah. And that's the same thing, right?
Yeah,
right.
And it's the same thing. So communicating in plain English I think is really important.
Right. Yeah. Yeah. I mean, I'm doing a CPG a supplement deal, and they talk about clean labeling, which all that means is you can read the label and know what's in the product. Right. And we sort of need a little bit of clean labeling around healthcare.
That's a great example. I like that. So that's great.
Okay, and then the last thing is, how do you personally stay current on all the changes in the landscape? Is there something you could recommend people should read, or something they should be following?
I think there are definitely some healthcare specific resources.
Besides my video series.
Exactly, which I'd start there.
Yeah, right.
But, frankly, we rely on our advisors, we rely on our investors, we rely on our network. I've found that I can spend days reading about something, or I can pick up the phone and I can talk to somebody who does this for a living in a specific niche of healthcare. And in an hour conversation, they can teach me more about the nuances of an issue than it'll take me forever to try to learn and understand it. So it's really talking to people that we found is the best way to advance our thinking on different opportunities.
Okay. Great. Well, thanks, Bruce. I really appreciate you talking me through it.
Thanks for
exciting
having me.
stuff.
Yeah, appreciate it.
Okay. Thanks.